right, let's get this show on the road.
Okay. My name is Pamela LaRue Troxell, and I first became acquainted with the Gonstead system in 1967, seeking care after two automobile accidents within a year apart. And that was my beginning experience in life changing.
1960, what was it?
67.
And that was your first time, hearing about it or actually feeling?
Both. Well, my parents would see a chiropractor from time to time. My father did manual blue-collar labor and, of course, needed some help musculoskeletally from time to time. Made him feel a lot better. And my mother, the same. She, besides a homemaker, was a very tremendous seamstress, which, of course, looking down and detailed sewing, I just am so grateful that my parents, I don't know exactly where they got introduced to chiropractic, but they were very holistic in raising us. We didn't spend a lot of time in doctors' offices, and of course, we were not neglected if something needed attended to, but that could have been back in that time, post Second World War. The country was coming together. I was born in 48. My dad came home from overseas, and that was life. You know, I know they took me to an osteopath when I was a baby, as I had sometimes some breathing difficulties. So I probably did have manipulation then, but we weren't ever really discussed about chiropractic or that form of care. They just made good decisions.
I noticed you said a couple of things. I noticed you said manipulation instead of adjustment. Is there a difference?
Oh, there's a definite difference. As a matter of fact, in the osteopathic realm, they're more non-specific, but they did know freeing up fixations and eliminating nerve pressure made people better. And so, along with chiropractic, in the 60s and probably before and after, certainly, they manipulated most patients that came in for a variety of health problems, but they manipulated as well as recommend medication. Or actually, in that time, they just manipulated. They did less medication. Then things changed, and they wanted to become more into the allopathic realm, and they gave up manipulation for, I don't want to be quoted incorrectly, but over 20 years. And now they've reinstated more neuromusculoskeletal correction. I don't know how specific they are compared to, but I was seen by an osteopath in my early 20s before chiropractic, and it was definitely a world of difference as far as a manipulation and specific adjustment.
When you were saying they, you're referring to MDs?
Yes.
Now, during that decade, let's just say the 60s, or we can start post-war, 40s, 50s, 60s, what kind of paint a picture for me of what the climate was like, the political climate concerning the larger medical political climate. Was it MDs versus chiropractors, and kind of just tell me about that environment during that time?
Well, from what I can recall as I was then growing up, but I don't ever depict any particular extremism one way or another. I think the AMA has always been bound to be number one and to serve people in what the science, supposedly the scientific data from early information that they gathered about disease from outside in, and the philosophy is so different, as you probably have picked up by now.
Yeah, we'll get into the philosophy. There's a lot of that, but let me kind of back up a little, because I've heard the name Troxell, and could you sort of tell me a little bit more about that name and your family? I know you kind of mentioned you're happy that they introduced you to getting manipulated or adjusted. So kind of you tell me a little bit more about your family, your parents.
Well, it wasn't until I had my first adjustment under a Gonstead practitioner, following up to a year of 2 traumas of whiplash, and the second one really started to create more problems. The first one didn't seem that much, like a lot of people. The car's damaged, but I'm not, and but the second one, I started to get headaches and tired. I was 19, so what 19-year-old doesn't like to go shopping? I didn't want to go, or if I took my mom shopping, I'd be sitting on a chair waiting for her, not the other way around, that the youngster was running around and the elder person tired of waiting. But I saw significant sliding of my health, and my parents, I was going to an MD that was doing some ultrasound or muscle stimulation and giving me anti-inflammatories, and I just wasn't improving. 3-4 months later, I was getting more headaches and more neck pain and more problems. So my father said, well, you should go see Dr. Grubb. And so I did. And sorry. That was where my life changed. And from that, sorry, catch my breath. Even 52 years later, it's such a great, deep emotional appreciation. So I started to see Dr. Grubb, and he explained, and he was a Gonstead practitioner, so he explained what was going on and what occurred. And I had, of course, growing up, a lot of other instances, falling off a horse full gallop. The cinch didn't hold in the saddle and me went on the ground. I did gymnastics, so I had a lot of sacral pounding, falling on my backside, and very active all of my life. So when Dr. Grubb explained what he saw, it started to have me recall so much of what had already happened. And it's like, wow, that's already like a blueprint. So, of course, I got better, and I became very interested at what this chiropractic profession is, and is it for women? And, of course, I thank Dr. Grubb for saying, well, yeah, and I think you would be good at it. So that encouragement was also very stimulating, and so I took the information, I applied at Palmer in Davenport, and was accepted for the fall 1968 class.
Is Dr. Grubb Dr. Gonstead?
No,
Oh,
Dr.
okay.
Grubb was my chiropractor back in Pennsylvania. I guess I'm not doing a good history follow-up of myself, but I was born and raised in Pennsylvania, and this was North Philadelphia, so in Bucks County, and I'm just so thankful, again, to be exposed to the specificity and the understanding and the science presented that has followed me all of my life.
I just thought maybe there was a different nickname for him that I didn't hear. I
No.
hear Dr. G, I hear C, I hear all it. So,
Well, it's another
so
Dr. G, but it's grew up not Gonstead.
And then something you said I want to kind of follow up on is, was there a lack of encouragement for women to pursue chiropractic?
I don't think there was a lack of encouragement. I think at that stage, when I graduated from high school, women had 4 career choices. One was stay-at-home mom, teacher, nurse, or secretary. So nothing ever, it was very rare that women even studied to be a doctor. I mean, they did, but very few. Matter of fact, my class at Palmer, there were 3 women for 100 males. So to tell you, just to show you, it was also a development of women kind of exploring being in fields that normally perhaps there wasn't an interest or a calling for, and now there was.
And today, what do you feel when you look out in that lobby and you see all these young women?
I'm very excited. And I didn't even think about it at that time back in '68 when there were few. What was, there was more momentum of women being at Palmer, not to do the DC course, the doctorate course, but to be assistants, to take the x-rays, do the exams, etc. And so sad to me today that that program is no longer, but a lot of good came out of women starting there, and often during the course of gals that were there to be a CA, chiropractic assistant, they, during their training, decided, I want more, and then they would stay. Sorry.
So because of, let's just say, maybe it wasn't a lack of encouragement, but obviously a lack of numbers, right? 3 to 100. Mm-hmm. Do you feel like somewhat of a pioneer or trailblazer?
I guess for that era, but when I look back at 1920, and when BJ was taking over the school, there were quite a few females. I belonged to the Sigma Phi Chi sorority, and I look back to those pioneers that of sisters that really, I think, also introduced the world that women in chiropractic are also accepted and phenomenal.
And I see people with the name tag. It says Troxell. What does it say? Intern.
Yes.
Kind of unpack that for me.
Okay, so I get to college in 1968, and my student doctor also practiced Gonstead. So at this point, I didn't know there were any other techniques that existed other than how I was taken care of. And so through the course of going through school, you start to see there's a divide of different techniques. And I met and married my first husband. That's the LaRue part. And he was South African and very, very good mechanical, knowledgeable, hands-on person. And after we were married, and he was closer to finishing, so I dropped out where I was to let him finish. And then when he finished, the plan was that I go back, which I did. So during that period of time when he was finishing, he had, his mindset was, this is the technique that we need to use. And of course, I'm in the lower studies. We didn't get anything in that particular technique until later. So I just accepted it as a good wife and student. And when I went back to school, Francois studied and got his IOS Iowa license and started to be an associate doctor with Dr. Troxell. So Dr. Troxell was head of the intern department up until 1972, from 67 when he graduated to 1972. And he felt frustrated because he was an educator beforehand and always an educator in his mind of how to make learning easier, and knew that it took a lot of hands-on if you chose this particular technique. So he and the school did not kind of jive as to what Dr. T, as we lovingly called him, felt needed to be done to get students more interested in the specificity of this technique. So he went into full-time practice, so people were then allowed to shadow him, and that became, in 1967, he developed the Troxell intern program, which students from school would follow him and shadow him in his practice.
And today, are you in that position now? People are following you and interning with you?
Well, I retired in 2013 in full-time practice, but we opened our clinic when we re-met in 1990. Unfortunately, I lost Dr. Francois in 1998. And I met Dr. G again due to a spinal fracture, and another life changer for me.
I can tell, I mean, it makes me emotional to think about it, but one thing I've noticed with a lot of the doctors I've been talking with is that they sort of, I mean, it's kind of like a testament to the Gonstead technique. There's a foundation, right? And like every doctor kind of builds on that,
Right.
including the mentors, what the mentor said or what this specific case, and so you're always kind of just building and building and building your own personal sort of representation, if you will. Might not be the right word, but you're building on this foundation constantly, every decade, every year, every mentor. And so for you, in your own sort of, if we call it a pyramid, right? What significance would you say Dr. G, I'm sorry, you're Dr. G, and kind of give me the pillars in your personal path up to this point.
Well, just as you say, the building, from even pre-chiropractic college, seeing Dr. Grupp, my intern doctor as a student, and then being mentored with someone with the passion and the skill and the devotion to keep educating people, not to get lost in all the technology, but to make it real as to how you approach patients and make it part of your chiropractic legacy, I guess. What's the pillar is the system. And when we follow that system, it's amazing how it all comes together, person to person, because the same person getting, or multiple people having the same headache formation may come from various different parts of their spinal problem. So it helps us to differentiate much clearer, person to person, what's the major or primary problem that we need to resolve, and then let the body continue the healing.
Couple things from me, and then I might ask these guys to chime in with a few questions. What, in your opinion, personally, given your experience thus far, I know you mentioned you're retired, but you're still very much involved and a part of the whole community at large. For you personally, what needs to be communicated to people who are just starting their journey? What needs to be communicated to the public? People like me, I'm not outside, or maybe never. I just got my first X-ray and adjustment last week
Wonderful.
before I came here. Okay? So
Excellent.
I can show you the picture, and you like, oh yeah, you should probably keep going. But what needs to be communicated for you? What do you want to communicate to two audiences? The people who are just starting, like the people in the lobby, students, but also to the lay public, specifically in America.
Well, to the lay public, first of all, healing comes within. You know, a lot of people, it's like, my doctor saved my life. Yes, I'm sure we have to give credit where credit's due. If someone's having a heart attack and the right procedures are acquired to bring that to a balance, to have stability. But where does the healing come from? The healing comes from within. So when we can bring the body to a homeostasis or a balance, then the real healing becomes innately involved within each and every individual. To our profession, I've said for many years, having interns for 20-some years, shadowing you, getting right up close to your hand, taking pictures, and it's a lot of pressure, but the compassion to compel them to own it themselves is, I suppose, my mainstay, and why today, especially today, where I think back 50-some 2 years, we had a lot more hands-on than today. Today we have a lot more basic science, a lot of wonderful education to pass boards and to understand various problems that arrive in our clinic. But my heart breaks when I see a lot of students don't come to events like this weekend, or very minimal, or they put in the minimal amount expecting great success. And sometimes that happens, but not regularly. I think over a 52-year study, I see many offices that don't make it, do not have a system. They do not have structure. And I've felt for many, many years our profession needs to have a constant follow-up. You know, when you go to a medical doctor's office, for instance, you arrive, fill out the paperwork, see the physician, and hopefully, these days maybe not, but there's a sequence of events people expect to have. The consultation, maybe an exam, maybe blood work. They don't like to take, GPs do not like to take x-rays, but you know, a basis, a groundwork of a diagnosis is formatted. Unfortunately, what I've seen grow more intensely over the years with more techniques and more, like, we're going to follow this direction, that direction. What feedback I've had over 50 years are people coming into the clinic that don't know what to expect. In this office, they went in, signed their name, gave their insurance information, maybe scribbled out their complaint, went in, would put on a table, pressed on a few places, and that was it. And so the public are more educated, and they're starting to see if they've had that type of care, and even if they had results, that they get to a point where they plateau, and then they start wondering, and they start talking to other family or friends that have been to various different techniques, some very specific and some very not. But I think that for the layperson is very confusing. How in one office you can be in and out in 5 minutes, and the next office somebody really cares to understand their pain, their problem, and show them why they,
Just 1 second, we'll continue as soon as
Okay.
I've Scott.
sorry.
Sorry again, Dr. Hardy. We don't have our assistant out there hushing everybody today. So,
It's okay.
sorry, please continue as soon as. Scott. Hold that thought. Hold that thought.
Okay.
Yeah. I know, hold that thought.
Yes, it's hard for me to hold thoughts sometimes. I get too much I want to say, and then it's like, that's not, you're not answering your question.
I have one follow-up question too, as soon as you finish that thought, and then I'm gonna ask if maybe you guys have to do it.
Okay.
Okay, go ahead.
So my concern is for the lay public, when there's so much diversity of care, when mainstream medicine, has a sequential pattern that people feel comfortable with. And I would like to see our profession reach some kind of agreement, I guess. Now there's the issue of students are kind of being feared about taking x-rays because now you're responsible for everything that's on that x-ray. And if you miss something, however, you don't have an x-ray and you think this person is in trouble at a certain area and you put a force into it and you shouldn't have. I don't want to explain that one. I don't want to be liable for that. If I miss something or, our education has advanced so much and I don't know if it's still the same today, but I remember when years back, we had more x-ray hours than a GP in our curriculum, more hours in physiology than a GP in our curriculum. The only thing we didn't surpass with them because we didn't have it was pharmacology because we don't use it. But we studied more hours in the same basic subjects than what a general practitioner did. So with that being said, we can determine if something just doesn't look right. And if you get that red flag, you send it to a radiologist. And of course now we have DAC bars in all parts of the profession, neurology, x-ray, etc. Let them look it over. In my particular city where I practiced, I would just take my x-ray, run up to the hospital, and grab a radiologist. And they were wonderful, and they really embraced that you cared enough, and you weren't sure, but you were caring enough and respectful that somebody else, that's their baby. That's their, the same way as instead of him manipulating a neck, maybe I should refer that person to the people that's their specialty. So you can get the drift of where I'm going is we need a steadfast, and instead of that, I think there's been a shift within our own profession that concerns me about that we've never really established. I don't care what technique you do, but the workup should be pretty much the same. But now, x-ray, there's radiation. Excuse me, what about that phone that's in their pocket all day long? Or, so enough said. I'm going to get myself in trouble. But it's a very real situation out there for the public that, why does that office take an x-ray? This one doesn't. And I always tell students, you can downsize a lot of things starting out, but know what you're feeling, know what the person's overall situation is, because you can't always feel those things, but you can sure see them, and it'll change those people's lives.
Anything you want to ask or add?
Um,
And then I'll wrap it up with
I'm trying to think of a good question, but the only question I keep coming back to is how did it change your practice, or maybe change the results you got? But how did it, what effect did it have that you did such a detailed exam? Like aside from the adjustment, but how did the exam and the detailed aspect of the exam change your practice compared to other things people have seen in chiropractic that might have even changed your patient's understanding of what chiropractic is?
Well, orthopedic feedback is important, and it gives you a baseline of, it can give you many baselines, and I don't think you need all of the orthopedic exams that we are taught, and certainly a lot of them you forget. But the basic ones that gives you, is this now more a lumbar problem or a hip problem? It just is another part of understanding this person's unique problem, because every problem is unique to that person, whether they have the same pain pattern or the same segment. There could be something below that segment that's influencing it. So a good exam also makes you understand the problem better. Hyper reflexes to hypo, is it exaggerated? Is it not existent? Is it weak? Is it spastic? Is it paralysis? All of those features, and I guess it starts with the visioning of the patient. You can see so much, which I think is important that we don't always put too much emphasis on. We had feeder rooms into our adjusting room, so when I would be ready for the next patient, I'd go and open the door, welcome them, and that's where my exam starts, because I want to see how they get up out of a chair, how they walk, what's their emotional expression. Are they looking down? Are they tired? Are they dizzy? Are they off balance? Are they, you see so much in a quick scan, and then I would walk ahead of them, and they know where to come sit to get a follow-up exam. And, all those things immediately tell me, are they better today, or something new's cropped up, or etc. So a good exam, and it doesn't have to be an hour long, but you can certainly detail it to get the feedback region to region, nervous system involvement, parasympathetic, sympathetic, a variety. There's so much. And over time, what is a blessing is you learn to do that very quickly and assess the initiating of your exam for that day.
Yeah, I know. Thanks for sitting in. So
Hope that helped.
oh yeah, we're gonna wrap it up with a message, and this time instead of looking at me, you're gonna look at. There's two cameras, but look into this lens right here.
Okay.
And I'd like to ask you to kind of analyze with what we broached on a bit earlier, but as a woman that has the experience you do, I want you to just leave a message to other young women chiropractors, young women students, young women who simply find only two other comrades amongst 100 men, and just give them a message.
Well, first of all, I'd like to congratulate and appreciate that you chose chiropractic over many other choices that you may have considered for your careers. This is a wonderful time, as any and all times, to be in chiropractic, because it serves all ages, all types of problems. Some are not totally fixable with just adjusting, because they may have a lot of co-existing problems or other problems attached to it. But you know, deep inside in your heart, no matter, I had so many spastic paralysis, spina bifida, children that were born that way through birth injury, etc. And the damage was significant. But what you learn as you accept each and every and all cases, that what you unleash that's obstructing balance within their body, and you allow the innate healing to advance, it is the most rewarding feeling. All the education, all the struggles, all the day-to-day, all the management issues, etc., just go away when you see someone come back in that was very almost suicidal because of headaches, and they've been around the block. They've had everything and anything that would help these severe headaches, and not receive help. And what you found and you followed up on and you adjusted made the difference. I don't know what better reward that is. Some people are in the profession because it sounds like a great way to make money, but the best way to serve people is to unleash the potential each and every one has. And that's been my life in chiropractic.
I lied because I have one more.
Okay.
Can you just, I'm going to sit back down and you can adjust me there on the couch when I sit down. But what, if any, do you use, so be looking this way at me now.
Okay.
What's the difference between, as someone who's adjusted many bodies over the years, what's the difference between a male body and a female body, and do you take that into consideration when you're adjusting?
Well, yes. Male bodies are usually more muscular and larger, and not always, but sometimes. And I can also filter that down to the difference between men and women, to hours-old babies, the difference of how you approach a newborn versus any age, and then or any particular gender. But yes, you do adapt, and you learn how much more intense you may have to be. But one thing that doesn't change is keeping the situation stable and very specific. And that seems to get through the most difficult problem to the least difficult. And I think that's what's a lot to be said for this particular technique.
Lastly, what is it? Can you explain that button you got on?
Well, that's the Troxell button. That's the intern logo for the Troxell intern program.
I thought it's a T over the... What about the underlying this circle?
Well, that's the Gonstead symbol as well. So over the years, since Dr. T's passing, and Dr. Lawler has manned up the program so wonderfully, that some updating and modernizing of symbols and putting them together, this was a great outcome. Making a statement of Troxell intern program based on the Gonstead technique.
Well, thank you so much for your time.
Thank you. I'm so sorry. I try not to lose it, but it is really hard not to.
Well, why, though?
Well, I always apologize because I know it kind of take some time out to recoil the emotions. But part of the emotions is what makes it real, for certain.
Is it because, like, I know you mentioned the passing of your Dr. Grog and then your husband as well? Is that right?
Yeah, my first husband, Dr. Francois, and what's so interesting is the full circle. Francois worked with Dr. T, and then I was an intern, and we had a good nucleus of friendship and workmanship. Then when we moved and came back to the area 13 years later, we got a chance to reunite that friendship, and Dr. T took care of Francois until he had passed. And then 4 years later, we reunite due to an accident I had. I had 3 compression fractures and burst fracture, and Mayo Clinic wanted to put rods in my back, and I said, I don't think so. We're gonna look at something else first. So they let me out of the Mayo Clinic with a body cast, and I went right to Davenport. We took an X-ray and saw that if I wore that cast 3 months as they proposed, I would not be straight today. I would be forward. So when I see older people walking at this angle, I know what happened to them, that care was mismanaged, and it's such a painful thing to see. So again, I was so reunited with my mentor, and we had an opportunity at that point in our lives to see each other in a little different aspect, and our friendship and love grew. And then I had the honor to be with Larry 24 hours a day, every day in practice, and the learning just excelled beyond that, and the love. So
I see. And I see a lot of when you see like old people walking
Yes.
like this, and is that irreversible? The rods, like you can't be like, oh, I messed up, take it out.
I've been with someone that a rod was taken out of their spine, and the neurosurgeon was really tremendous in allowing me, number one, to be present in the surgery, but he also agreed with what I found for this young woman who had Harrington rods due to scoliosis. And one rod came loose, so it wasn't even locked under the vertebra anymore. So when she came to me for specific pain and I saw it, somehow I came across this person. I asked who would be good, and we went there together. He looked at everything. He said, yeah, we can take it out. It's not doing anything anymore. And it hasn't been, who knows how long it's not been attached. So that's that experience load.
All right. Thank you.
Okay.
Thank you. Thank you.
I hope I'm not a hard one to edit
not
and
at
put
all.
together, because
Thank you.
it's been a wonderful journey.